you for standing by, and welcome to the COVID-19 media briefing. All lines have been placed on mute to prevent any background noise. To ask a question during the session, you will need to press star 1 on your telephone. If you require any further assistance, please press star 0. I would now like to hand the conference over to your speaker for today, Mr. Mike Schomer. Mike, the floor is yours.
Thank you for joining us for the COVID-19 media briefing for April 8th. We'll start today with opening comments from Health Commissioner Jan Malcolm, State Epidemiologist Dr. Ruth Linfield, and Imam Hassan Jama, Executive Director of the Islamic Association of North America. We'll then open it up for questions from reporters. With that, I will now turn it over to Commissioner Malcolm.
Thank you, Mike, and good afternoon, everyone. Since we spoke on Tuesday, the situation around the world and in the United States remains similar, actually with cases and unfortunately deaths both rising a little bit faster again than they were reported on Tuesday. So we're over 133 million cases around the world with almost 2.9 million deaths worldwide, and in the United States, nearing 31 million cases and 559,117 deaths. Here in Minnesota, we had a report of 2,535 positive test results yesterday that came on a volume of 44,111 lab tests that were processed. So we reported those numbers this morning, bringing us to a new cumulative total of 535,182 laboratory confirmed cases of COVID-19 since the start of the pandemic here in Minnesota. The rate of case growth and testing growth are up just a little bit week over week in both cases. We've seen an increase in cases of 2.6% this week compared to last week at this time, up from 2.4% the prior week. Testing volume is up 2.9%, up from 2.8% the week prior. There are 565 people currently in Minnesota hospitals with COVID-19. Of those, 131 are in intensive care. There's been a cumulative total of almost 28,000 patients hospitalized with COVID-19 over this past year, and 5,732 people have required intensive care. And sadly, we reported another 14 COVID-19 deaths this morning that were reported into the health department yesterday, bringing us to a cumulative total of 6,922 deaths since the start of the pandemic. On the vaccine front, we surpassed the 3 million dose mark. Almost just over 3 million total doses of vaccine have been administered to Minnesotans. This is a combination of first and second doses, and that is doses that have been reported into our immunization information system as of Tuesday. So the number of people with at least one vaccine dose is now over 1.9 million. And the people who've had a complete series of COVID vaccination is almost 1.25 million. So that means that 34% of Minnesotans have received at least one dose, and 22% have now completed the vaccine series. With respect to folks over 65, we're now at 83% of Minnesotans over age 65 having received at least one dose, and 72% with complete series. With that, I will turn it over to Dr. Linfield for an update on the variant situation. Ruth?
Thank you very much, Commissioner. The race between vaccination and variants continues. And to help keep a close eye on this, we've taken several steps to expand our ability to monitor for variants. We've added additional lab partners to help process more samples from positive COVID cases to see which form of the virus is involved. Our public health lab is sequencing about 350 samples per week, while the University of Minnesota Genomics Center and Infinite Biologics, both UMGC and IBX, were vault samples. These groups are also sequencing samples for us. For the past 2 weeks, 800 samples on average have been sequenced. This is about 7% of those cases. IDX has started sequencing this week, and the extra capacity will help give us a better picture of the spread of the variant. We estimate that 50 to 60% of our SARS-CoV-2 infections currently are due to variants, particularly B117, the variant first identified in the UK. CDC has said that this B117 variant is now dominant in the US. Keep in mind that this variant is considered to be more easily spread, and in the UK was found to be more likely to cause severe illness. We've confirmed 1,573 cases of B117 in Minnesota. Approximately 4% have been hospitalized, and unfortunately, 5 persons have died. Since January, we have seen local transmission, clusters, and outbreaks in a range of settings, including long-term care, youth sports and sports clubs, restaurants, and corrections. Because sequencing is not being done on a random sample, we cannot yet compare outcomes to the prior strain, since the sequence samples may not be representative of the total positive sample. In addition to B117, we are finding more of the 2 COVID variants first reported in California. We detected 337 cases of these variants called B1427, B1429. Approximately 2% have been hospitalized, and unfortunately, there have been 2 deaths. Only 18% indicated that they traveled, with most acquisitions happening in Minnesota. Clusters and outbreaks are also occurring with this variant. We have identified several new P1 and B1351 cases, mostly associated with foreign travel. We have now confirmed 5 cases of P1. This is the variant that was first identified in travelers from Brazil. One of our cases has been hospitalized. Not all our cases have been reached for additional interview, but 2 reported travel to Brazil and 1 to Mexico. We've confirmed 26 cases of B1351. This is the variant that was first identified in South Africa. 15% have been hospitalized, and 65% of those that we were able to reach, 65% total have reported international travel, primarily to Africa. We are still trying to reach, for second interviews, a number of individuals. 1 case of B1351 occurred in a person who had traveled to India. Our message regarding the variants is that they are spreading, and we need to continue to be careful while more Minnesotans get vaccinated. I would now like to turn the conversation over to Imam Hassan Jama. Thank you.
Hello, my name is Imam Hassan Jama. I'm the Executive Director of Islamic Association of North America. We are a nationwide umbrella organization with over 35 countries and organizations. In Minnesota alone, we have more than 15 countries. As you may know, Ramadan is approaching quickly, and the scholars and the imams of Islamic Association of North America, IANA, and other clerks have agreed that taking the COVID vaccine is permissible. It's also agreed by the scholars taking the COVID-19 vaccine does not break one's fast because it's not considered food and drink. Ramadan 2021 is due to start on either April 12 or 13, depending on the site of the moon. The COVID-19 does not invalidate the fast of a fasting person, because it's not considered, as I said, food and drink. Some people may have side effects after vaccination, such as fever or headache. It's okay to break fast if you are not feeling well and need to take medicine, drink, or eat. It's important to take care of yourself. As the leaders of the community, we put together guidelines for the Islamic centuries. Because as you may know, in the Ramadan, during the night, we get together and pray together. Of course, with the guidelines of with the MDH and the CDC, with social distancing, during the mosque, all time, hand sanitizers, all these things. So we brought guidelines to the countries, and also we gave awareness and education to our community. Of course, is their right and to participate their faith. At the same time, we had a huge discussion about the well-being of the community and the society at large. Some of the recommendations we gave try to minimize the number of using at one point, the mosque, and also try to short the prayer so we will go quickly. This Ramadan is a big challenge for us because it's the first Ramadan that we are practicing our religion as a group, the Ramadan, and we try not to scare the people. At the same time, a lot of people, they want to practice their faith and come to masjid and pray. Also, prayer and spirituality that helps, the depression and stress and all these things. A lot of people, they feel calm and healed when they get, service, religious services, when they get together, when they pray together. We try to word out and educate the community. Imams and the leaders of the community are working very hard, try to have a peaceful Ramadan and to minimize the spread of the COVID-19. I would like to appreciate, the state leaders, state officials, and health departments, their contribution. As we speak now, I came from Abu Bakr Islamic Center, where 300 individuals taking COVID-19 vaccination, Johnson & Johnson with just one shot. There is a lot of COVID-19 vaccination happening, last week and this week, before Ramadan. So we try to give as much we can to vaccinate the community. So when they come for service, at least they get the vaccination. Thank you. I would like to turn over the mic now.
Thank you very much. Operator, we are ready to take questions.
Thank you. And as a reminder, if you would like to ask a question, please press *1. Our first question comes from the line of Jeremy Olson of Star Tribune. Your line is open.
Hi, all. I apologize for any background noise, but I wanted to ask about supply and demand of vaccine. We get 3 million doses administered today, but do you have any concerns that we're going to start to see supply outstrip demand, that people aren't going to want it as much anymore? And do you have any plans in place to kind of get the remaining people in to get their shots?
Jeremy, this is Jan. We do anticipate that at some point in time, there will be more vaccine available than there are people just really waiting in line to get the shots. And that we will at that point be really looking to recruit people and to double down on our efforts to encourage people to take the vaccine. I just want to take a moment to thank Imam Jama for joining us today and for his and his colleagues' important work to support their community, to give them clear guidance from trusted leaders is exactly the kind of thing that we're going to need to do a lot more of in the coming months. I think we're a ways away yet from the point at which the supply really does exceed the demand, as you're asking. I don't think we're close to that yet. Perhaps in some particular demographics or some particular pockets, but in general, we still have a lot of people eager to get the vaccine, and we hope that that eagerness, frankly, continues, and that people do get vaccinated just as soon as they have the opportunity to do so. As Dr. Linfield mentioned, we really do consider this a race against time and against the variants. So hope that Minnesotans stay eager to get the vaccine and do so as soon as they can.
Quick follow-up question. I have seen some leveling off, though, in the teacher population. A vaccination rate in K-12 educators has stayed below 70%, and it's kind of hovered and stalled out at about 82, 83% for seniors. So if those groups are in your guide, there is a cap. I guess I'm wondering if 80% is a realistic goal, if that's a goal that we'll actually ever reach, or is that something beyond what we can hope to achieve?
It's a fair question. We're actually thrilled with the 82% overall uptake among 65 plus. We know that's not even a complete count. We know that doesn't include folks who may have spent the winter elsewhere, gotten vaccinated elsewhere, for example. But that's, it does suggest that it's going to take us some time to get to that overall 80% level. It's going to be a continued education and outreach campaign, just so important to meet people where they are. I mean, we do know that some of the first groups who were offered vaccine and polling that was done or interviewing surveys that were done suggested that people were not saying that they would never take the vaccine, but they wanted more information. They wanted to see how the rollout went, what the experiences of other people were, and we're hearing more and more that people want to hear messages about vaccine safety and effectiveness from the people that they know and trust, their physicians, healthcare providers they know, community leaders they know. So we do believe that this is going to be an ongoing campaign to get people information so that they can make good decisions. That will go on for many months, certainly, but we do anticipate continuing to have a good Minnesota response to the opportunity to get vaccinated within these next couple of months here.
Thank you. Next question comes from the line of Catherine Wickert from Minnesota Public Radio. Your line is open.
Yeah, hi, kind of in the same vein as what Jeremy is asking. We've been talking today to the public health director for Faribault and Martin County, who told us that she's actually declining her public health department's allocations this week because they simply cannot fill those spots. And so I guess I'm just wondering, in addition to those counties, are you seeing other counties say, no, we simply don't have the people to give those shots to, or is this a first?
Well, we have had different vaccine providers report that experience, and that is one of the things that we have looked at throughout the pandemic, the vaccination rollout, to inform when we open up eligibility more broadly, which we now have done, of course. But also we look at feedback like that on the ground as we make our allocation decisions going forward, and targeting more doses to where there are larger population centers, where there's less of a percentage of people vaccinated, where there are particular gaps in vaccine access or take-up. And something that we're beginning to look at now is also kind of layering in where we think particularly high case growth in terms of where we might direct some allocation of vaccine.
And so, sorry, just to clarify, are you saying then that you're still seeing the most demand right now in the metro areas?
Yes, definitely. I think the reports, such as you mentioned, are not the typical report that we're hearing, but we have heard that feedback from some specific vaccinators in some specific communities that they've reached the people who are the most eager to get vaccinated right away. So there will continue to be outreach efforts to folks who may be having a harder time getting access to the vaccine, whether that's transportation related or what have you. So we know there are more people out there that want to get the vaccine. Even in areas like that, it's just a matter of probably a little more effort to get the vaccine to them.
And just to make sure I'm understanding this correctly, is this a matter of, let's say that a county says, they were going to get 300 vaccines next week, and they say, no, we don't want those after all. Is it literally a matter of just saying, okay, let's put that into a community site in Rochester or a community site in the Twin Cities instead and increase the number of appointments there? Or I guess I'm just looking for a little more detail on exactly like how that reallocation, what that actually looks like.
Yeah, that's basically how it works. If we every week we do talk with the vaccine providers, whether that's in the form of one of our 8 regional preparedness coalitions that are helping to kind of coordinate vaccination in a geographic region, or we talk to individual local public health departments or health systems or pharmacy chains to ask that exact question. Here's what the amount is that's available. Can you use that? And in some cases, not often, but periodically, a vaccinator will say, I don't need 500, I need 200, or whatever the case may be. And then that differential is able to be put back either into, distribution elsewhere in that region, or potentially, to a specific event. You mentioned, one of the state sites, or an event that is maybe a community pop-up event. So that's one of the good things about having a really diverse vaccinator ecosystem is there's lots of places to be able to redirect those doses. So the doses aren't just sitting unused.
Okay, thank you so much.
Thank you. Next question comes from the line of Chris Rogers from WNOA Post. Your line is open.
Thank you very much. I had a question for Commissioner Malcolm, if I could. Back on the March 26th eligibility announcement, you had said the state expects to get up to 500,000 doses a week and maybe more. Are we at that threshold yet?
No, we are definitely not at that threshold yet. And again, I think we've talked about this a little bit on prior calls, but it can get tricky to unpack these numbers and make sure we know what we're talking about, whether we're talking just about first doses or first and second doses. Actually, if we're talking about first and second doses, we are close to that 500,000 mark a week. If you add up what the state gets, that the state allocates out, and what the federal government directly allocates to, for instance, that federal retail pharmacy program. But I tend to think in terms of the first doses, so how many more people are going to be getting vaccinated this week compared to last. And those numbers, have been fluctuating a little bit, again, between what the state gets for us to allocate out and what the federal government is allocating directly. This current week, for instance, we're at about 340,000 total first doses between what the state is allocating and what the federal government is allocating.
Are you concerned about those numbers at all, or hopeful that they'll go up?
We do. We think we continually are reassured by our federal partners that the supply, while it seems to be kind of leveled out for the time being, that amount is going to grow further and potentially quite quickly, or is planned to grow quite quickly with more and more of the Johnson & Johnson vaccine becoming available later in April.
Thank you.
Operator, we have time for one more question.
Thank you. Next question comes from the line of Jason Miles from WCCO TV. Your line is open.
Hi, we were just wondering, all these people are posting their selfies with their, vaccine cards, and we're wondering what exactly the purpose of the vaccine card is and what people are supposed to do with them.
This is something that many of us might remember from our childhood. It's a way of keeping track. It's for the person who's gotten the vaccine as a record of when they got the vaccine, can be a reminder of when they should get the second. I mean, ideally, folks get their second dose vaccine scheduled at the time they get their first dose if they're getting a 2-shot series. But it's really just a record for the person's own use.
Okay, great. And also, what happens if someone loses it?
That is a good question. Dr. Linfield, do you happen to know, is there a system for replacing that if somebody wants? And we do have, through the immunization information system, we do know who's been vaccinated, but I don't know if there's a process for that.
Yeah, there is a record in our vaccine registry, the Minnesota Immunization Information Connection, and if it is needed, certainly the healthcare provider can access that and write it down. And if need be, I think that a person can contact us and we can also get them the information if they need to show proof of immunization and they've lost the card.
Okay, great. Thank you. And one really quick follow-up. We're just wondering about the vaccine equity efforts in communities of color that might be underrepresented, how the effort's going.
Well, I think it's going better all the time. I think we have better information, we have better data on where where those differences in rates are, and we're working with a broader and broader array of vaccine providers all the time, and the healthcare systems and others are targeting some of their efforts to reach particularly affected communities who've had a higher burden of COVID illness and who are currently not getting vaccinated at the same rate. So a lot of work is going into trying to be very intentional about getting the vaccine into the community and really working, as we talked before, about supporting and encouraging and educating people in the community to take the opportunity when they have it to get vaccinated. And certainly the site that's going to be starting up next week, that's supported by the Federal Emergency Management Association, is going to be a major boost to those efforts too. As we've talked about, that State Fair site is specifically aimed at creating vaccine opportunities for folks in some of the zip codes in the metropolitan area that have the highest social vulnerability index. So that's a very direct equity strategy that will significantly add to the state's efforts.
All right, thank you so much.
That is all the time we have for today. We invite any reporters with additional questions to reach out to our office this afternoon. Have a good day, and we will talk with you again next